Hello, I'm Dr. Paul Williams. I'm one of the preceptors for the Campbellford teaching practice site. Campbellford is a small rural town located about 2 hours northeast of Toronto. The population of Campbellford is about 4,000 people. In our town we have a community hospital, a 34-bed hospital, which is run by the family physicians. We have a family health team, which is located conveniently right across the street from the hospital. In our Campbellford office of the family health team, we have 5 family doctors, 3 of whom are preceptors for the teaching practice. Although Campbellford's only a population of about 4,000, the hospital has a catchment area of about 25,000. And our family health team serves about 16,000 patients. So for your time here, you'll be working with one of the 3 preceptors, myself, Dr. Henderson, or Dr. Collins, and you'll be doing your family medicine rotation in the Campbellford office. And you'll also be looking after patients in the hospital across the road with one of the preceptors. A typical day in the life of the resident, usually we start doing rounds at the hospital in the morning, 8:30 or so, see our patients, and then we come and start clinic around 9:30 or 10 o'clock, depending on which doctor you're working with. While you're here, we encourage the residents to work as independently as possible. Each resident has their own day sheet. Patients are booked to see the resident. The residents have been coming to Campbellford for more than 25 years, so our patients are very used to seeing resident doctors. They're happy to see the residents. We have a procedure room in the office where we do a lot of minor office procedures, lumps and bumps and ingrown toenails. We also do a lot of joint injections, so we encourage residents to get a lot of hands-on experience while they're here. In addition to the family medicine clinics, during your time here, you'll do 1 emerge shift a week in the hospital. And we also have the residents working with some of our consultant specialists who visit the hospital. We'll do a lumps and bumps clinic with our general surgeon in the hospital. We also have visiting general internists, rheumatologists, dermatologists, and you'll get to spend half days or full days in clinics with these specialists while you're here. You'll be required to be on call 1 weekend a month, and during that weekend you'll work with the preceptor and look after all the inpatients in the hospital from Friday night till Monday morning. Living accommodations are on the second floor. It's an apartment on the second floor of a house which is located right behind the hospital. So it's about a 2-minute walk to the hospital and about a 4 or 5-minute walk to the clinic. So you don't need a car most of the time while you're here. However, getting to Campbellford, there is no public transit to Campbellford, so having a car is...
Hi, my name's Dr. Bob Henderson, and I'm part of the Campbellford Trent Hills teaching practice. We've been associated with the University of Toronto for over 30 years and enjoy having residents with us. We work at the local community hospital, and this is Campbellford Memorial Hospital. It's a 34-bed hospital with 4 special care unit beds. We have an emergency department, an operating room, and ward bed services. When a resident is with us, we help that resident to work in the hospital. Hospital work is an important part of rural medicine, and most physicians who work in rural areas are attached to some local community hospital. It's important for residents to have that experience of working with hospitalized patients. I'm absolutely convinced that residents who look after inpatients do a better job looking after patients in their clinics. This is because you're looking after sick patients, and you've become more comfortable with advances in medical technology and in pharmaceuticals. In any event, we always ask that the resident carry 3, sometimes 4 inpatients at a time, operating as the most responsible physician. So that requires that the resident visit the patients under him or her every morning, examine them, write notes, write orders, and generally direct their care. The preceptors are always in the background, available for consultation, and at any time the preceptor may approach the resident and ask for an update on their inpatient load. We try hard not to overload the residents with this, but uniformly residents enjoy the challenge of looking after inpatients here in Campbellford.